Mobilization are you going to do? Posterior. You're going to do a posterior glide, so an AP glide. Okay, so they're always named for the direction that you're moving. Okay, so, or direction that you're moving. So posterior glide, or it's called the direction you're going from to the direction you're going to. So sometimes it's referred to, a posterior glide can be referred to as an AP glide, because you're going anterior to posterior. Okay, and if I want to increase dorsiflexion, what am I stabilizing? The tib fib. And then what am I mobilizing? The talus. Everyone with me? Stabilize, tib fib, mobilize, talus. And so we have convex surface moving on a concave surface. So convex on concave is V to A, opposite. So dorsiflexion, your foot moves forward in the anatomical plane, which means we're going to do the opposite and push the talus backwards. Is that too fast? Do I need to go through that again? Convex on concave, opposite. Dorsiflexion is anterior, therefore we move the talus posterior. Okay, it always helps to have a little joint distraction before you push down. Okay, and with all joint mobs, you want to be really, really as close as possible to the joint line, and that way you're going to be most effective. Okay, so then there's also things called mobilization with movement. So we're going to learn more. Okay, stand up. And bearing do we do that puts us into dorsiflexion? Squat or a lunge. Okay, so when we go into a squat or a lunge, really the talus is remaining stable, and now our tib fib is moving. Okay, so it switches, but you're still doing the same glide. Okay, so come stand on this side and put your right foot up on here. And then actually, sorry, bring it back down. Step back a step, and now put your right foot. Okay, so if I have her lean forward to put weight on your right leg, she's going to go into dorsiflexion. Okay, so if she's limited in dorsiflexion, this motion will be limited, or it might be painful. Okay, the tricky part about the ankle, so do you mind if I tell them what you told me? No. Okay. So Becky's been having some pain in the front part of her ankle. Okay, so we often think, well, then there's something wrong in the front, but sometimes tightness of the calf and the soleus will manifest as pain in the front. Okay, and that's not something you'd be expected to know, it's just something that you might end up seeing. Okay, so that would be for the PT to figure out what was causing that pain, how are we going to fix it, and then you could assist with the joint mob. Okay, so what I'm going to do for the mobilization with movement is same thing, I'm going to mobilize the talus, but at this point what it's really going to be more like is I'm going to block the talus and have her move her tib fib. Okay, so my hand is in the exact same place it would have been with the joint mob. And then I'm just going to have you lean forward.
So you're pushing posterior.
Yeah, and then come back.
So it's posterior.
Yeah, so I'm just blocking it.
While she's moving.
And she's moving. Now, if she had any knee pain, this would not be ideal because this is putting a lot of pressure on the knee. Okay, and that's one reason I had her step further back to limit how much her knee is going forward.
So if you weren't blocking it, her talus is moving.
This is the way you can do it.
Well, so the whole point of joint mobs is we're trying to facilitate the arthrokinematic motion that should be occurring. But sometimes that arthrokinematic motion gets blocked or is not doing what it's supposed to, and then you end up having pain. So I'm facilitating the arthrokinematic motion during the osteokinematic motion.
But if you weren't blocking it, in her case, everything would be moving forward?
No, internally the talus should be moving back more. I'm just making it go even more.
Oh, okay.
And part of the reason I think she's having that anterior pain is because the arthrokinematics aren't happening the way they should. mobility in there. Audible. Okay, no pain?
No, not until I get to the end.
Different? Still right at the end.
Are you pushing hard before?
Yes, but no. So to make it easy on myself, notice my elbow is completely locked out, and all I'm doing is leaning forward. So I'm not really actually using any muscles in my arm, I'm just using my body weight. Because otherwise the amount of force I would have to use to push, it would be more than I'd be able to do. And even if I was able to do it, I'm going to fatigue or injure myself. Okay, so it's locked out and I'm just leaning into it. And I lean in more as she comes forward. Let's do 2 more. And the only reason to have her foot up like this is it makes it easier for me. Okay, and then a cool thing you can do is do carryover for home. So let's come over here. And step forward till there's a little bit of tension on there. Okay, and now step this leg back. Okay, and then go ahead and same thing, lunge forward here. Now she's doing it to herself. This might start to pinch and get uncomfortable, so sometimes like you can just roll up a towel and put it in there.
Mm-hmm.
But this is an easy one to carry over for home. As long as the ball stays steady.
I want to pull that out of there.
No beast
Pretty
mode.
good.
No beast
What
mode.
would you use
back
at your house to hold the belt?
So it wouldn't have to be, this is actually a gate belt. It could be just like a regular belt.
Right.
And then like if they had a really sturdy table or something.
How hard is Becky like going into the motion?
As hard as I can.
I mean, she's really just doing the lunge. She's not trying to do anything more. This does all the force.
Oh, okay.
Because if you have it taut, and this is an elastic, this will help stabilize the talus. So she's just really regular lunging back and forth. And it's not even a muscular challenge lunge. It's just going into that motion. Okay, and then what post measurement should I take to prove whether or not this worked? I would take her dorsiflexion range of motion again, which I go-need earlier. Okay. Okay, let's come back up to the front.